as a team, we also perform a lot of advanced laparoscopic procedures as well. We probably perform some of the most difficult advanced laparoscopic procedures out there. And some of the technologies that we use is still, being developed. And as we're using it in our advanced procedures, we're actually helping develop the data for these new devices and actually help standardize the techniques of how we use this. Example, for gut surgery, we use devices to guide us in how repair hernias for patients who have hiatal hernias like diaphragmatic hernias and things like that. We use devices to measure how we close the diaphragm, how tight or how loose should we close it, how much repair should we do. And before these technologies were around, we never had a scientific way of measuring this, and each surgeon was doing it based on what they feel or what they think and how their training was. And I think we should move towards standardizing some of these things with the use of technology. My personal interest, of course, besides bariatric surgery, is also foregut surgery, meaning hiatal hernia repairs, achalazias, esophageal diseases, things that are, number one, very difficult to treat. Number two, not a lot of surgeons have experience how to treat this. For example, if something like achalasia or esophageal disease, you can count on one finger in one hand how many surgeons are able to do different procedures to treat these, surgical or non-surgical, endoscopic or not. I'm so proud that we're probably one of the very few programs in the country that combine advanced endoscopy and laparoscopy in one practice. One of the very few programs in the country that can treat esophageal disease endoscopically and surgically in the same practice. You will not find that easy anywhere else, because surgeons understand endoscopy as well as actually better sometimes as some endoscopists out there, because we understand the anatomy inside and out, and that's what gives us the edge in treating some of these hard to treat diseases.